Well, it's really humbling to be speaking here to you today. I have participated in this conference in the past. I've watched Inmed grow up into the world-class organization that it is, and I really congratulate Dr. Nicholas and his staff for just an outstanding ministry, an outstanding program. This conference is just one really small piece of a great pie of impact occurring around the world. And you all really are, many of you are the experts. You're the practitioners. And I should be sitting out there listening to you. Instead, it's the other way around. So I do understand I'm preaching to the choir today. Now, I don't consider what my message this morning really a didactic type of presentation. You'll get a lot of good, hard facts. When Nicholas asked me to speak, I said, I just want to inspire people and motivate people to use the gifts that God has given them to serve the poor in the world. That's what I want to do. And I said, you'll have lots of good speakers who are the experts. Let me just share some of the experiences I've had, share a few stories that reflect on this. And so that's what I want to do today. Now, there is a little table over here to my left, your right, that has some material from Heart to Heart. And Kirsten and Kendra are two of our staff members who are here, and they'd be happy to talk to you. Heart to Heart, many of you know of the organization that does a wonderful work all over the world in many different areas. And then I've got some of my own staff also from Docs Who Care. This is the way I still make my living in practicing medicine. I've got a couple of books for sale. And in fact, what we're going to do is, as soon as I'm done that table, I've told them to bar the door, and you can buy your way out. Maybe there's another exit back there. But I do have a couple of books. The latest one is The Power of Serving Others. And another book, that book, by the way, was written for a non-Christian audience, to nominal and non-Christians, The Power of Serving Others. Obviously, it has a wonderful Christian message because the message of Christianity is a message of love and compassion and service. The other book is called When There's No Burning Bush, as when you think of Moses, Following Your Passions to Discover God's Call. It's a book written to believers who are searching for God's direction or God's will for their life. And I think it's a great book, and if you're sitting out there wondering, what is it that God wants me to do with the rest of my life, that book will speak to you. Anyway, I sell them on a sliding scale. You all know what a sliding scale is. If I was speaking in the church, they wouldn't have a clue. But they'd say, oh, tithing, is that a sliding scale thing? I like that. But a sliding scale means that the books retail in the bookstore for $20. Well, I sell them for 10. And if you're a student, you can have them for 5. And if you don't have any money or can't afford 5, you can have it for free. So that's my sliding scale. Wouldn't that be someone ought to come up with an idea like that in healthcare. Wouldn't that be a great idea? A sliding scale. People who can afford it ought to pay triple. People who can't should pay what they can afford. Well, the topic that I was asked to speak on today is why care for the poorest? And of course, right off the bat, a couple of questions come to my mind is, well, who are the poor? And what kind of poverty are we talking about? One of the poorest people I ever knew was a lady by the name of Agnes Bohaksu. I know I'm not pronouncing it right. It's an Albanian name. Who all of you know. Every one of you know Agnes, because after she became a nun, she took on the name Teresa, and at the age of 18, traveled to Calcutta, India to serve the rest of her life in one of the poorest cities, economically poor, in the world. And I had the privilege of working with her for many years as a volunteer. Heart to Heart, one of the greatest projects we ever did was to bring 120 volunteers and to Calcutta, along with a FedEx plane full of $12 million in medicines for her work. But I had the chance one time to bring my 3 daughters with me, and they were all younger at the time, to introduce them to her. And we were working in the orphanage volunteering there in Calcutta, and suddenly one of the sisters came running up to me, and she says, "Doctor, Mother wants to see you and your children. Please go to the Mother house now." So, when Mother Teresa calls, what do? I said, "Sure." So we got out in the road and flagged down a rickshaw or a taxi and headed over to the Mother house. I thought, wow, maybe we'll get to spend a little one-on-one time with her. We got there, and one of the sisters says, "Doctor, you have a seat here on this little bench," and she goes, "Mother wants to talk to your daughters." She came out and took my 3 daughters into her private quarters, her little room, and spent about an hour with them. All the while, I'm having to sit out there waiting. So I just thought, what is going on? What? This is unheard of, to have her invite someone into her private quarters. Well, they finally came out and they were smiling, and of course I was grilling. What happened? What did you talk about? What did she do? What was she wearing? They were in her bedroom. And they said, well, she didn't have her sari on. She just had a little nightshirt, but her hair wasn't covered. She has hair, Dad. She has hair. I hadn't even thought about that. But here's what what really impressed them, among many of the things she said to them. I said, well, what was in her room? And they said, all she had was a bed and a table and a chair. And then she had a whole bunch of McDonald's Happy Meal boxes along the wall, and that's what she kept her possessions in. I'd heard her tell that story before I saw her once even carrying a Happy Meal box. And she was so intent on giving up any worldly goods that she would use a McDonald's used Happy Meal box to store her saris, the 3 saris she owned, or the rosary, or her Bible, or whatever. Well, now, would you say Mother Teresa was poor? Well, maybe poor economically or in possessions, but certainly she was not poor in love or compassion. She was rich beyond measure. She was poor economically by choice, of course. I remember once I thought, I used to get letters from her, and whenever I'd open the mailbox and see the old-fashioned, remember the letters that were thin paper from overseas with airmail and had the little colored things on the side? I'd see one of those letters, and I'd know, okay, well, I got a letter from somebody overseas. And then I'd see the typed on the envelope. I could hardly read it. Some of the letters were skewed all different angles. I knew it was a letter from Mother Teresa. I'd been over to her Mother house many times. She had this old beat-up typewriter. And, it should go in the Smithsonian. It's just, my kids wouldn't even know what it is if they saw one today. And it still used ribbons. And she would type on that until you could hardly read anything. I decided, this is ridiculous. She and her sisters are pecking out little letters on this ancient typewriter. I'm going to bring her a laptop and a printer. Now that is good stewardship. I'm paying for it. I'm going to give it to her, show her how to use it. So next time I went to Calcutta, I had my laptop, I had a printer. I'm going to give it to her. I whipped it out and explained to her what this was. I said, it's really great. I said, you can write one thank you letter to somebody that's given you something, and you can still make it personal, but you can keep their addresses. For instance, I know you write to the Pope all the time. You could keep his address in there and just hit one button and it would go, Your Holiness, the Vatican, Rome, whatever. I said, isn't that a great idea? She shook her head. No, she didn't have what she said, I don't want it. I said, Mother, you don't understand. This is going to save you time so you could spend more time with the poor. You won't have to type these letters by hand. You can save standard content. I just said, then finally I really pulled out the best one. This is good stewardship. This is what the Bible talks about. Use your time wisely. She still said no. I kept working on her. Finally she says, okay, fine. Give me the computer. But I'm going to sell it and I'm going to take the money and give it to the poor. Well, there's a lot of ways to define poverty. There's economic poverty. There's spiritual poverty. There's Emotional poverty. There's the poverty of the lack of health care. This is a healthcare conference, and I want to focus on the poverty of health care. There are a lot of people who are poor in health. Some of us are poor in health, no matter how excellent our health care resources are. So I'm not talking about health so much as I'm talking about the opportunity or the access to the resources of health care. To a great degree, whether you are poor in health care, resources, access, has to do with where you live, of course. Now, like many of you, let me just get a show of hands. How many of you have served either let's just talk internationally, have served internationally in a poor area of the world in healthcare? Raise your hand. Okay, I knew this is a big choir. I mean, I knew I was speaking to a lot of experienced people. You know that there are a lot of areas, and you've been to them, that are tremendously lacking in access to health care. They're poor when it comes to health care. Now, how many of you work here in our own country with people who have limited access to health care? Raise your hand. Just as many hands or more. So it's not just the geography of country or nation, it's even within our own countries, within our own borders. Where you live and your economic class has a lot to do with the poverty, the level of your poverty when it comes to health care. I remember many years ago finishing medical school in residency and got my MPH, and this was at the kind of the golden era of maybe healthcare, or what we told ourselves was a golden era. And I remember flying around the world working in different countries, and I'd have healthcare officials and ministers of health come to me and say, you know, you're in your country, you have the best healthcare, and we need this, especially after the fall of the Soviet Union. All these Soviet republics were trying to figure out how they were going to provide health care. And I'll never forget, it happened many times, but an official from the healthcare ministry would ask me if I could bring an expert on health insurance from our country so they could have health insurance. Yeah, it's laughable, isn't it? I used to actually think, well, maybe that would be helpful. Now I realize, now when I travel abroad, I'm telling these ministers of health, would you figure it out and then send it back to us? One of the countries right now that's working in spending billions of dollars in healthcare reform. We're still talking about it, of course. We hope to get there in this country, but one country that doesn't have to talk, they just make a decision and then issue a decree, and billions of dollars start flowing towards it, and they get working on it. And that's the People's Republic of China. How many of you work in China? So you know what's happening in China, the disaster their healthcare system is, but on the other hand, the reforms that are being instituted even today. And I believe 10 or 20 years, China will have a healthcare system that's really is something that maybe we can import to our country. Who knows? Well, so poverty of healthcare has a lot to do with where you live and your economic status. But one thing we can agree on, within our own country, there are millions of people who are poor in healthcare. And around the world, there are billions. So why should we care? Why should we care for those who are poor in healthcare? 3 quick, simple reasons, many more. I won't spend a lot of time on them. Number 1, we should care for the poor, particularly because this is our profession of healthcare, those who are poor in healthcare, because our faith compels us. I could spend the rest of the session talking about how our faith compels us, propels us, calls us, motivates us, requires us to give to those who are in need. And we are blessed with with resources and training in healthcare, and our faith compels us to share that with those who are in need. And certainly, that's why when people ask me, how did Heart to Heart get started? It goes back to my faith. It wasn't about trying to figure out a way just to create another NGO or a not-for-profit that could go about doing good things. It was about the fact that I felt called as a believer. This is my mission. Gary, this is why you're on this earth. You've been blessed with an education and training and resources, and I want to use that on behalf of the poorest of the poor in healthcare. That's it. That's good enough for me. And in my way, God uses all of us in different ways, but in my particular way, it had to do with mobilizing other people to serve. And that's what Heart to Heart is all about. I remember working on a project in Gaza, in the West Bank, many years ago. And in fact, right now, one of the other not-for-profits I head up is actually sponsoring a project in Gaza, as well as Heart to Heart, shipping in medicines. But I remember having to talk to Yasser Arafat. They wanted me to meet with him to get permission so that we could send in our medicines and volunteers into Gaza. And it was one of those times when the conflict was very, very bad and very dangerous. And Arafat wanted to know, who are you people? You know, Heart to Heart was just a little dinky organization getting started. Who are you? What's this all about? You know, there's a lot of suspicion about Western organizations who are serving, a lot of skepticism. And some of it's well-founded, some of it's stuff we just have to dig through and fight through. And so, as I said to ambassadors and ministers of health and government officials hundreds of times, I said, well, let me tell you why I'm here. First of all, it's because of my faith. I said, I will tell you, you are my Muslim brother, but I'm a Christian, and my faith compels me to serve, and that's why I'm here. But I will tell you this, I will honor your laws, your regulations. In no way will I seek to proselytize or do anything that you tell me I shouldn't do. I'm here to serve the needs of your people. You can trust me. And he did. We hugged each other, and he goes, you're welcome. Heart to Heart is welcome to work in Gaza. And I was able to get in and organize the project. So our faith compels us. The second reason that we should care about the poor, particularly the health care for the poor, is that reason demands it. Reason demands that we care for the poor. If you're just a rational person, it makes sense that we should do everything we can to equalize the healthcare resources so that all people have some access to it. It doesn't make sense not to. I mean, I think a group of economists could sit here and tell us, you know, the more we take our healthcare dollar and use it for basic healthcare necessities and needs for all people, the less it's going to cost us in the future. You know, you know the statistics better than I do, but isn't it that 1/3 of all of our healthcare dollar is spent in the last 30 days of a person's life? Well, how much is spent on the first year of life, the first 5 years of life? You know, there has to be a way for us to you know, we're the richest country in the world, still. We're down about 1/3, but so is the rest of the world, so we're still the richest country. We can put people on the moon. We can build the best, you know, the bomb. I'm a reservist, by the way, in the Army, so I put my uniform on regularly. So I say this with respect, but we can build the best bombs and we have the best technology. Why can't the smartest, richest people in the world come together to see that health care is available to all people in our society? Surely we can do that. And you know what? It's not only the right thing to do in that our faith calls us and compels us to do it, it's also the rational, smart thing to do. We're quote, shooting ourselves in the foot by letting this system go on as it is, so out of control. And some of you are sitting here and saying, well, I don't agree with you. You know, we do have the best health care and we do have access. Well, I know we can argue a lot of the fine points. I'm an emergency room doctor. That's what I do. That's how I make my living. And I have doctors tell me all the time, anybody in this country can go to the emergency room and be seen. That, I say, you're exactly right. You know what? And I see those people. And I write them a prescription for amoxicillin, even something that's cheap. And you know what? They don't have the money to go out and fill their prescription. I can spend $1,000 of your tax dollars doing x-rays and everything else when they're sicker than a dog, but they can't even afford the medicine. Unless I admit them, put them on IV Levaquin or something like that. It's the rational thing to do. Reason demands it. Thirdly, why should we care for the poor? Our future depends on it. Not only does faith compel us and reason demand it, but our future depends on it. Now, how many times have you sat in a speech or heard a commencement speech or been at a church and heard someone talk about the fall of the Roman Empire and why it fell? And depending on what you're arguing that particular day, you can say it was because of that. There are a lot of reasons the Roman Empire fell. I'm definitely not an expert, but I'll tell you, recently I read in, I think it was The Economist, that one of the most accepted theories of the fall of the Roman Empire, the reason was because of the tremendous disparity in the economic levels between the rich and the poor. That the disparity had grown so large in the Roman Empire and all the abuses that followed because of that and all the problems that really at the root of the fall of the Roman Empire was a disparity in economic level and all that entails. Well, I don't know if that's true. I will tell you, though, I've been working in China since 1980. I made my first trip to China in 1980. I've gone back almost every year, many times, multiple times in a year. I went there in 1980 to study their public health system. I was working on my MPH. I went to study their system of barefoot doctors. And I came back thinking, wow, what a great idea. I mean, Mao simply said, we've got this problem with access to health care. We need village health workers, maybe is what we'd call them now. So the government's going to train millions of these people, give them a few months of training, and send them back, and at least we'll have a basic level of health care. Now that worked for several decades. And then China, as it grew richer, and again, these are my interpretation. There are some of you here that probably could really set the record straight, perhaps better than I. But what I saw happen was as China became richer and developed a free market system, somehow it got the idea that free market system in healthcare was the best. And that because the United States was touting its healthcare system as the best, that must be the way to go. So they developed a more of a free market system than we do at this stage. They have the most unbelievable free market system. It's great. I mean, a doctor, if he writes for moxicillin, he gets $1 back. If he writes for Levaquin, he's going to get $10. Isn't capitalism great? It's wonderful. And it's working in China. Well, it worked for a while. It did get them to a certain level. And now it's failing them. And that's why China's reforming its healthcare system. In a sense, they're going back to the barefoot doctor. What they're doing is they're saying, we are going to train general practitioners and family physicians and primary care doctors. And we are going to build a community health center in every county in China. We are going to fund it in conjunction with local governments and provincial governments, but you have to do it, and here's the deadlines, here's the benchmarks. We are going to have health care access for all of the Chinese. Now, the reason I say our future depends on it, the greatest threat right now in many countries is not so much a military threat, it's a threat of a civilian population that's facing tremendous economic pressures that could lead to widespread civil unrest, which could lead to all kinds of problems. I'm a colonel in the reserves. One of the greatest threats that our military understands is not the threat of China's military, but the threat of a society that has millions, hundreds of millions of peasants who are disenfranchised from the economic miracle of China, and that includes health care. I have been working with projects in North Korea. People say, what in the world? Are you crazy? Why would you do anything to help our enemy, the North Koreans? Well, I believe wherever there's a need, we need to be there, serving, doing everything we can to get health care to those who need it. And definitely, there are 28 million North Koreans that are horribly impoverished because of their government. But that does not mean that I'm going to stand by and do nothing. But North Korea, again, the same thing. Anything we can do to bring health care to the poorest of the poor in any country in the world is good for us, is good for our future, and our future depends on it. Now, a couple things to keep in mind as we think about health care for the poor. I could give you many, many little suggestions, but I just picked out a few. Some of these will resonate with you. Others you'll think, no way, that's ridiculous. But number one, be resourceful. Now, I'm going to tell you a story that some of you have heard if you've heard me speak, and I may have shared it here. But I guarantee you, once you've heard the story, you will not forget the point. Hopefully, you won't forget the story. You may forget the point. Be resourceful. I was in Israel with a group of senior citizens who were traveling, and coming to the end of the trip, and as we drove up to the airport in Tel Aviv, all the people were getting off the bus, stepping down that last big step, and an 80-year-old lady stepped off and fell to the ground. Well, I saw it just happened right in front of my eye. I thought, oh no, I wonder when her plane leaves, because she's just broken her hip. This is going to be a problem. Well, she stood up pretty quickly, and I realized then probably not a hip, something else. I checked her out. It was obvious she'd broken the bones in her wrist. And I said, Miss Nielsen, I said, your plane leaves in 2 or 3 hours. I said, honestly, I can put you in a little splint and a sling and get some ice on it. I even got some pain pills I carry with me. Get you something for pain. You can get on that plane, and when you get to Boston, 24 hours later, 48 hours later, it's no big deal. You can go see the doctor. He'll take care of you. Or you can go to the hospital here in Tel Aviv, but I guarantee you, it'll be an all-day thing, and we'll have to rearrange your flight. Well, she decided, okay, I'm going home. So I fixed her up. I said, your plane leaves before mine. I'll stay with you until you get going. I helped her check in. We got out to near the gates. What's the last thing you do before you get to the gates? It's security. And so there's the machine with the black straps hanging down, and we're putting our purses on and our backpacks, and I'm looking at it, and I'm thinking, I guess I could call it epiphany. It was that kind of a thought. This is an x-ray machine. Why not x-ray her wrist? And maybe I can make sure those bones are aligned right. I mean, better to do it now than 24, 48 hours. So I convinced the guy running the machine that this was important to national security. And so he said, well, okay. I acted like I knew what I was doing. That really gets you a long ways, let me tell you. You just act. In the Army, they call it command presence. They actually have a course in it, how to BS people into thinking you know what is what I call it. Well, the guy running the machine thought, he thought, okay. So I told Miss Nielsen, I said, look, stick your wrist inside those black straps. Take a big breath and hold it. That's what they always say. She did. I ran around to the screen where the guy was, and he was shaking his head. He said, it's not working. I said, you mean your machine broke just now? He goes, no, it's not the machine. He goes, you can't have something just static. I mean, the thing has to be on the belt and moving through the machine. You can't, it doesn't work anyway. I said, okay, well, hold on. I went back to Miss Nielsen. By that time, her Vicodin had kicked in. And I said, Miss Nielsen, we got to change in plans here. I want you to hold your hand out, lay down on the belt. I'm going to lift up your legs, and you just ride through the machine. And I'll be at the other end to meet you and get you down. So she did. I ran around to the machine. There was a beautiful X-ray of her entire body with her hand out, kind of like Superman. And we could even zoom in. I mean, this was before PAX was ever invented. This was like the earliest PAX. I should have patented the idea. But we zoomed in on it. It was perfect, and everything looked good. Why do I tell the story? You won't forget the story. The point is, be resourceful. I can guarantee you one thing, those of you who seek to serve the poor in healthcare. you will not have all the resources you need. I guarantee you a second thing, you will not even have the resources you deserve. You may have hardly any resources. Does that mean you give it up? That you, in despair, you just say, well, I guess we can't, I've tried to raise money to build this clinic and so-and-so or do so, and I can't do it, so I guess we give it up. No. Be resourceful, which moves to my second point, second idea, suggestion. Be available. Even if you don't have the equipment, the resources, you can be available. There is power in your presence. One of the most memorable patient encounters I ever had happened outside the office in a moment when I was not even, I was prepared to see a patient. All I had was a stethoscope with me and a bag, a shaving kit, literally a shaving kit with a few of medicines that I always throw in there, Cipro, some pain pills, a few things that I keep just in case I need them or someone needs them. I was in Kosovo serving in the military. And one of the nice things about the military, they allow me to work with civilians and do projects. Heart to Heart has done many projects jointly with the military, particularly when I've been on duty. And so they were allowing me to work out in some of the villages. And one of the things I did was identify who the missionaries were and the people who were working in those areas and introduce myself and then ask them how I could be of service. One night we were traveling together. I was in my uniform and I had a Humvee and driver and all that, and I was following them. We had been to visit a little village on a healthcare related matter. And they said, do you have time? It was like 10 o'clock at night. Do you have time to stop at a little village? There's a patient, a lady that's dying of breast cancer, and we've just gotten a message, and they wanted to know if the American doctor could stop and see her. And I thought, there is nothing that I can do for this lady. But I thought, of course. I mean, I'll at least go and do what I can to reassure and to show some compassion. So we drove in this little village, and by the time we got there, it was so late. It was dark. I walked into a little room in this Muslim household, and there the lady is, struggling for breath. I'm sure it was metastasized to her lungs. She was thin. She was cachectic. She was dying, and I knew she was going to die that night. And the family thought that somehow I was going to work a miracle. Here the doctor had come. And I had my little shaving kit and a stethoscope, and that was it. And I just thought, what can I do for this lady? And through my interpreter, I tried to explain to them that there was really nothing that I had, that anybody had anywhere, that could really save her life. But what I could do is do everything I could to make her comfortable. So I said, I have some medicines here, some pain medicines. I think I even had a diuretic. I'll give her a diuretic, that'll help. She had some bad congestive failure. So I gave them some medicines, and I decided, I've got to do more. And the missionaries that were with me said, well, I asked the lady, I said, I'm a person of faith, and one of the things I want to do, if you would allow me to, I want to pray for you. And she says, please, we want you to pray for her. And like I often do, I deferred to the missionary with me. And the missionaries use that time. Now, understand this, I'm not telling this story to make any theological points, except that we're compelled to show compassion to those who are poor in health care. But the missionary took the opportunity to use that prayer to make that lady basically beat her over the head that if she didn't accept Christ that night, she was going to be damned eternally. That was the prayer. Well, that backfired. So I decided it's time to have a battle of the bands, I guess, a battle of the prayer. So I responded and prayed that her God would give her comfort. And then I asked her, I said, is there anything else you would want me to do? She goes, yes, I want to go out to the front yard and to die. Would you please carry me to the front yard? I want to look into the sky. So we picked her chair up, literally her chair up, and just carried her chair out and set her right out under the stars. She looked into the heavens. And I said to her, are you ready to die? And she said, yes. She goes, I can see my father. I can see my brothers. They're calling to me to come home. I said, and you believe you will be with God forever? And she goes, yes, I do. And I said, I will see you on the other side. And she died. And I left there and I said to myself, I don't understand it all. And I'm not going to worry about it. But I know one thing. I want to go where she is. I want to be with her. And if that's to hell, let me go to hell. If that's to heaven, it'll be to heaven. Because what counts is that I'm going to show compassion. And I don't have to say anything. I don't have to preach sermons. I don't have to give theological reasons for this and that. My job is to show compassion, to love. And even when I don't have the resources, even when I don't have the medicines, you know what? I can be there. I can be available. And I think that's one of the greatest things that we have the opportunity to do in our own country and throughout the world. What better time, and I'm going to go ahead and close, forget my last point. Time is out, my time is up. But there's in Chinese, the Chinese, this wonderful language is they use characters. It's like hieroglyphics. They literally often refer, the character actually is a representation, maybe of a man or a woman or a house or a roof. It's really neat. It's an easy language to learn. I mean, I've learned probably 5 or 10 of these characters, and it's just simple. You just memorize them. It's a house. It looks like a house. Well, the word for crisis in Chinese, a lot of times when they have a complicated word, they put other words together, other hieroglyphics together. And the word for crisis in Chinese, if you're here and know Mandarin, is a two-character word. And the way the Chinese define or describe crisis is danger, the symbol for danger, and then the other symbol they put with it is opportunity. That's what the Chinese, how they refer to crisis. It's danger, but there's also an opportunity. Look around us. We live in the day and age when there is tremendous poverty of health care in our country and around the world. What better time, whatever your faith is or no faith, if you're a person of faith, your faith compels you. If not, reason demands it and our future depends on it. This is the time for us as healthcare professionals to stand up and say, we're going to devote our resources, what limited resources we have, but certainly we are going to make ourselves available to bring healthcare to the poorest of the poor. Thank you so much again for this opportunity to speak.